All right, this is the Peak Performance Pros Lab Overview. My name is Dr. Amber Krogsrud. I'm a naturopathic doctor in Los Angeles, California, and I am the naturopathic doctor on staff at Peak Performance for optimal athletic performance and recovery for our players. So we're just going to run through some of the conventional labs that are run, as well as what we do differently to really set our program apart. So this is a standard lab panel that you would get through your conventional doctor. They usually spend, 5 to 10 minutes running through what's high, what's low, and then a brief plan of what to do about it. So on this test, we have vitamin D, CBC, which is a complete blood count, looking at red blood cells and white blood cells. Also, hemoglobin A1C, telling us about the last 3 months of how your body's been handling blood sugar. Your glucose, which is more of an immediate marker of blood sugar regulation, which plays a huge role in inflammation, ability to recover. DHT, which is a form of testosterone, form of androgens in the body, as well as fatty acid status. This is the second page looking at estradiol levels. This player is actually a 27-year-old male. If you looked at him, you would think he is in robust, vibrant health if you saw him walking on the street. However, when you pull apart his lab results and look at what's really going on a cellular level, there is so much optimization to be done. We actually found that he had super elevated creatinine kinase. He was training super hard and breaking down a lot of muscle, and his kidney function was compromised. So we'll see that later on. More labs here. Homocysteine, marker of really systemic inflammation of the brain. We want to have that below 7. However, on this lab, it's not flagged as high. It's in the reference range. We have DHEAS, which is a marker of adrenal function, and IGF, which is what your liver produces. One of the active components of growth hormone, as well as cortisol, which is the hormones secreted from the adrenal glands to help us wake up in the morning, get us going. Elevated levels of cortisol over time can really wreak havoc on the body, as well as the lipid panel looking at cardiovascular risk, creatinine kinase, which we looked at on the previous page as well, and then an iron panel. So this is how we go through labs with our players. We go through something called Optimal DX. It's a blood chemistry analysis, and this is a really valuable report that we walk through with all of our players, and it's way more in depth. We spend at least an hour on it with our players, walking through really the correlations. We get a lot more overlap in terms of what labs relate, what are the probabilities of dysfunction. We can really have more involved treatment plan. This quote, "Disease does not develop in your body overnight. Neither does an injury when you're a player and it takes you off the ice or off the field or out of the ability to play." So really, we know it's an accumulation of how you've been living for days, upon months, upon years. So it's not a one-time event. What we really specialize in doing is helping prevent those injuries, those health concerns, so that you stay on the ice, and that not only are you able to play and perform, but you're performing at your best, because we're really optimizing what's happening on a cellular level. So some of the benefits of looking at functional labs, which is what we're doing when we go through the Optimal DX report with our players, is it's more in depth, it's more valuable. We identify problems before it's too late, like an injury or a chronic condition. We can also help individuals overcome chronic health issues like anemia or certain underlying pathologies that can really impact their energy or ability to recover and perform. It's results-based medicine, so we're looking not only at labs but your symptoms, and sometimes you don't know how good you could feel until you start feeling better. And I find that to be true with a lot of our players. It's about performance optimization. We really want you to play your best on the ice, and that starts at a cellular level, what's going on in your body. And this is really so valuable because it's not being utilized within a lot of athletic arenas, especially in the hockey world. We're not actually addressing the smallest subunit, which is the cellular health, looking at the functional labs, really making interventions that move the needle in terms of performance. We also give our players a metabolic assessment form, and with the labs plus some of these forms, we can get like a total body scan. It's kind of like taking your car into the shop and really checking in on every system. What's happening with digestion? What's happening with mood? How about reactions to chemicals? Any sort of brain fog, issues in recovery and repair, skin changes, fatigue, how your body's handling food, and blood sugar regulation. So we get a really good pulse on what's going on, and then we can make appropriate recommendations for that. But this is so much more in depth than anything that you will get going to a conventional doctor. We also have the brain function assessment form. These different sections tell us about different issues that may arise. Brain function is so valuable because it tells us a lot about blood flow, can tell us about nutrient depletions like B12, B6, certain things that are really important for focus and cognitive function, and then mitochondrial health. Mitochondria are one of the pivotal secrets to performance that are really not being utilized. We know that muscles have more mitochondria than any other cell. So by optimizing the mitochondria, we can really not only protect the brain, but really help optimize performance. Now we're going to jump over to this. Okay. Optimal DX, and I'm just going to walk you briefly through this report. Okay, so this is a pretty long report that we spend a lot of time going through with our players. We have the probability of dysfunction, things to focus on for this player. Remember, he's a 27-year-old male. One of the biggest things to focus on was sex hormone function. So the testosterone levels were subpar. There's a lot of things that we can do to normalize that naturally. Immune function, kidney function, blood sugar regulation. So all things to focus on here. It'll give us a breakdown. What's the percentage likely, and much improvement is required. All of the labs that they took into account. And then it'll give us a really clear idea of how to move forward. Testing and not guessing is really powerful because it gives us pinpointed solutions to what's going on with the body. And of course, we always take into account the symptoms or what the patient, the client, the player is experiencing in their training and their recovery. And then looking at labs, we can get a really good idea of what's going on. Immune function, it would surprise you how many people actually have some type of unknown, undiagnosed gut infection, bacterial overgrowth, dysbiosis, that would be impacting their energy, their ability to recover. And so we can detect this and treat that if necessary. We can look at kidney function. We can look at blood sugar regulation, which plays a huge role in the ability to recover, and how you feel after meals. Really sets up the body for inflammation when blood sugar is not in range. Prostate function, we can also get more information about inflammation, heavy metals, oxidative stress. That's a huge one whenever we're talking about exercise, high level sports, training hard, late nights, maybe some suboptimal food, we're experiencing a lot of oxidative stress. And that's a huge obstacle to recovering and really playing at the best. So, can evaluate a lot of these. Also looking at macronutrient status, so hydration, fat, vitamins, minerals. And the more labs we run, the more information we have on all of these. The beautiful thing is this has like an algorithm where it will take into account all of these different lab markers and give us probabilities of dysfunction. We are low in DHEA. That's a hugely valuable precursor to some of our androgens like testosterone, which help with muscle building. So in this player, we did add in some of that. B12 and folate play a huge role in brain function, in reaction time, which is really valuable when split seconds matter in athletics and in hockey. Iron, vitamin C, B6, some of these nutrients that we can tell that we're low in. Okay, clinical dysfunction. So we actually ran a stool panel on this patient and did find a gut infection. Testosterone deficiency, H. pylori, kidney function, viral function. We can look at all of these different things. Also, thyroid function, really important for energy and metabolism. And then it'll tell us really what to focus on. More breakdown here. And then it'll give us all the individual levels. So when you look at regular labs from your conventional doctor, they will look at the range from here to here. So this entire bar, but we really want it to be in the middle bar, which is the optimal range here. So all of these will give you more information about, what's happening in that system, where do we need to optimize energy and performance based on this. We did find that this player had really elevated creatinine kinase, so a lot of muscle breakdown and some compromised kidney function as a result. So we supported him there. Can look at all these minerals, magnesium being one of the more important ones. Iron, ferritin, we see that elevated sometimes when there's a lot of inflammatory load on the body. It's an acute phase reactant. This is all related to iron. Also lipid panels. This can tell us about some inflammation in the body, elevated cholesterol, triglycerides. We're looking at cardiovascular risk factors, which I've seen young men in their 30s with really elevated levels due to stress and diet and lots of lifestyle pieces. So we definitely work on that. Thyroid function, inflammation, this is one of the more important ones. And then optimizing some of these vitamins that might be depleted, because the mitochondria, the cellular function really depends on having these cofactors and these vitamins for recovery and repair. Also, hormones, really important for our players to optimize that. And as much as we can, we have lots of strategies, both natural and, prescribed, that we can use. CBC, looking at red blood cells, white blood cells in the body. This is really our first line of defense, checking for serious issues. Okay. More about the white blood cells. And then we get this beautiful comparative chart. So if we run labs, say April 29th, and then at the end of this program, 6 months later, we run them again, we can really find out what changed and make appropriate recommendations in accordance with what we find. So that's how we track it, is really rerunning these labs and seeing where the players are at. And just another breakdown, what are the labs that are most out of range? We knew that the creatinine kinase was the highest, as well as the triglycerides running on the low end. And another comparative report that if we ran another panel of labs, we would have them in this column as well. So this report is super valuable. It'll tell you more about each marker, why it's off, why it's elevated or low. and everything that's associated. We love to educate our players, and then we have a robust treatment plan based on what we find in these labs, really addressing underlying issues, maybe a gut health, maybe a gut infection, potentially low hormone levels that can really impact their brain function and their ability to play at their highest level. So, this is a little bit of a health improvement plan, and then sometimes we'll have recommendations at the end. It depends on what would be appropriate for each player. But this is our program. Would love to bring in your players, have them be a part of it, see their performance optimize, and really evaluate holistically what's going on through a different lens that can really empower their ability to play and to get to the next level. Thank you so much.